Hi, I'm Joseph Gauta, MD. I'm a board-certified urogynecologist in Naples, Florida. My practice is the Florida Bladder Institute, and I perform transurethral bulking in the office for stress urinary incontinence and intrinsic sphincter deficiency in women. It's a very easy procedure. I use the GStirrups all the time because it helps stabilize my patient's legs, and it makes me feel more comfortable about getting the procedure done in the office using a standard electric or non-electric gynecology table. I typically start with a 30-degree rigid scope and a 17 French sheath. I use plain sterile water in a half-liter bag, and I use regular IV tubing that attaches with a lure lock right to the cystoscope and its bridge. With macroplastique, I use the Labrie macroplastique needle, and I typically inject at 3 sites, approximately the 10 o'clock, 2 o'clock, and 6 o'clock position of the urethrovesical junction, approximately 1 or 2 centimeters distal to that junction, period. Sorry, I say period all the time. When I'm injecting Bulkamid in the office, I either use the Bulkamid scope or I prime a standard, flexible, adjustable Labrie needle with the Bulkamid solution, and then I use that through a 17 French standard cystoscopic rigid scope. Both give me excellent long-term results, and the patients tolerate the discomfort incredibly well. I give them a 2% lidocaine jelly approximately 10 minutes to 15 minutes before I start the procedure, and it's very easily performed in the office. Usually your reimbursement is also greater in the office. I prefer the Labrie needle over the standard Bulkamid needle because it's narrower and much less painful when I'm doing the procedure in the office. It requires a little more pressure with your thumb to be able to get the solution through that thinner needle, but the results are well worth it and the patient comfort is much better.